Hello everyone. Please subscribe Dr. Ravichandra official. Today we will discuss myocardial infarction or heart attack. Death of a cardiac muscle with prolonged severe ischemia due to coronary artery occlusion is called as myocardial infarction. Risk factors are advancing age, atherosclerosis, middle-aged males, postmenopausal women. Coming to etiology, pathogenesis. Coronary artery atheromatic plaques undergo an acute change with intraplaque hemorrhage, ulceration, or rupture. And the platelets on exposure to subendothelial collagen and necrotic plaque contents mediate the formation of the microthrombi. And the vasospasm is stimulated with mediators released from these platelets. And the coagulation pathway is activated with the release of the tissue factor. Complete occlusion of the vessel lumen results with the expanded thrombus. The arterial trunks that are involved are left anterior descending coronary artery is the most common one. Second, right coronary artery, and the third one, left circumflex coronary artery. Patterns of infarction. One is transmural infarction. The necrosis involves a portion of the left ventricular wall in its full thickness, and this is transmural infarction. Subendocardial or non-transmural infarction. The necrosis involves inner third of the ventricular wall. And multifocal microinfarction. In this, many intramural small necrotic foci are seen. So, totally there are three patterns of infarction in myocardial infarction. One is transmural infarction, second one is subendocardial infarction, and the third one is multifocal microinfarction. Morphological changes occurs in two patterns. One is reversible injury and the other is irreversible injury. Reversible injury occurs within first half an hour or 30 minutes. There will be no gross or microscopic changes. And in the irreversible injury, there will be gross and microscopic changes that will begin after 4 to 12 hours. In 12 to 24 hours, gross examination shows dark mottling, and in microscopy, you can observe coagulative necrosis. 1 to 3 days, yellow tan infarct on gross and neutrophilic infiltration will be seen on microscopy. In 3 to 7 days, yellow tan infarct with hyperemic border on gross and macrophagic infiltration on microscopy. 10 to 14 days, there will be red-gray infarct with depressed borders on gross examination, and there will be granulation tissue deposition on microscopy. In 2 to 8 weeks, there will be gray-white scar on gross and there will be prominent collagen deposition on microscopy. After 2 months, the scarring will be complete on gross examination, and on microscopy there will be dense collagenous scar. Clinical picture, there will be prolonged chest pain more than 30 minutes duration, squeezing or crushing in nature with rapid weak pulse, and there will be diaphoresis, nausea and vomiting, and shortness of breath, dyspnea. Investigations. First, cardiac markers. Cardiac specific troponins T and I, creatine kinase, MB, mass, and myoglobin. Within 3 to 12 hours, CKMB, troponin T and I are elevated. CKMB and troponin I peaks at 24 hours. CKMB returns to normal in 48 to 72 hours, but troponin I will be raised in 5 to 10 days and troponin T will be up to 14 days. Myoglobin rises within 1 to 3 hours and peaks at 6 to 9 hours and returns to normal in 24 hours. Please remember mnemonic T-KZIL. T stands for troponins, C stands for creatine kinase, AST stands for AST enzyme, and L stands for LDH enzyme, and E stands for ESR. That is, in myocardial infarction, troponins, creatine kinase, AST, LDH and ESR will appear. Coming to ECG, there will be ST elevation with transmural infarct. In subendocardial infarct, there will be no ST elevation, and there will be non-specific changes in the ECG with microinfarctions. Complications of myocardial infarction are cardiogenic shock, arrhythmias, myocardial rupture, ventricular aneurysm, pericarditis, cardiac failure. For further information, see my other video which shows post complications of myocardial infarction. Do subscribe and press bell icon if you found this video helpful and show your support.